Within the study, we looked at a national database that's run through the American Cancer Society, looking at 144,000 women diagnosed in the late 90s to early 2000 that have a complete evaluation as far as their survival over the subsequent 5 years. We evaluated these patients on how well their care appeared to be compliant with nationally established guidelines through the NCCN, or the National Comprehensive Cancer Network. Within this, we were somewhat disappointed to find that only 43% of patients appeared to be receiving adherent care. This adherent care mostly was related to the surgery that they went through. Typically, we're finding that they weren't getting the appropriate staging biopsies and/or reported procedures that would be appropriate for patients with newly diagnosed ovarian cancer. We took this a step further to see how this lack of adherence to the guidelines affected patients' survival. Unfortunately, patients' survival was definitely decreased, about 44% decreased if they had non-adherent care to national guidelines. These guidelines have been around a long time. They're something that we all have access to, and so we looked further to see if surgeon volume or facility volume was reflecting some of these differences, and in fact, yes. At our lowest volume facilities, so surgeons or hospitals that only performed 1 to 6 surgeries per year, had the lowest adherence rate with the guidelines of approximately 30%, and unfortunately the lowest survival, only about an average survival of 32 months. Our highest volume centers, areas where they do greater than 26 surgeries for ovarian cancer yearly, had the best survival and an adherence rate over 50%. This translated into about a 15-month improved survival for patients that had their surgeries performed at high volume centers, as in areas where they do a lot of this type of surgery. We also looked at different types of cancer centers and found the research-based NCI-sponsored cancer centers also had the best rates of compliance or adherence to the guidelines, and ultimately the best survival. For patients that are newly diagnosed, what kind of questions should they be asking? They really need to be saying, is this the area that's going to offer me the best chance of survival? What options do you have for me from a standpoint of research opportunities? And is this a diagnosis that I should think about traveling to a tertiary care center, a large cancer center, to where I can hopefully achieve the best care? What we don't know from our research is, what we're looking at is initial surgery and initial chemotherapy. Is the fact that people live longer at high volume centers, the fact that they have more opportunities for research protocols or have opportunity to participate in other care projects dealing with maybe psychosocial issues, side effects from chemotherapy, and support groups. All these things we think are important for maintaining health and best quality of life for our patients.